Okay, we are going to go over what's called directional terms. And directional terms are a list of vocabulary words that help you to talk about body parts in relation to other body parts. So it's a type of terminology that we use in the medical profession to basically indicate locations of different parts of the body to each other. It's always important to understand that we always are using anatomical position. Anatomical position is facing forward, upright, feet right underneath the shoulders, and palms facing forward. It's important that the palms are facing forward because that sets up the radius and ulna in parallel. If you go palms backwards, then the radius and ulna switch orientation to each other. The radius is always in line with the thumb. So we're going to use anatomical position and with relations to these words. And what I'm going to do is just go through the definition and then use an example sentence. Once we get to a point where you will be assessed on this knowledge, you're going to need to basically define the word and then use it in an example sentence. So it's important to practice. First word is interior, and interior is towards the front. The sternum is interior to the heart. So what I'm talking about is basically relating the sternum to the heart, and sternum is more in front of the body form than heart is, so the sternum is anterior to the heart. Deep is away from the surface. Your surface is the skin, so anything in relation to the skin is going to be deep. Muscle is deep to skin. Okay, so basically the muscle is farther away from the surface than skin is. Never use bone as an example in relation to muscle. Don't say bone is deep to muscle because it's not in some cases. Distal is away from the point of attachment. You have two attachment points for limbs because this word is in relation to limbs, your arms and your legs. Point of attachment of the arms is the shoulder. Point of attachment of the legs is the hip. I'm going to give you a couple example sentences. You're just responsible for one, but I'm just going to use a few. The elbow is distal to the shoulder. So the elbow is farther away from the point of attachment than the shoulder is. The forearm is distal to the elbow. The wrist is distal to the forearm. The fingers are distal to the wrist. You can do the same thing down at the leg. The ankle is distal to the knee. The ankle is farther away from the point of attachment than the knee is. Inferior is towards the bottom of the form, so something is below something else. The chin is inferior to the nose. Intermediate is in between two body parts. The nose is intermediate to the eyes. So the nose is directly in between the two eyes. Lateral is away from the midline. The midline is an imaginary line dividing you into a left and a right. It goes right down your backbone in relation to other parts. So lateral is away from the midline. The ear is lateral to the nose. Okay, so the ear is farther away from the midline than the nose is. Medial is towards the midline. So the nose is medial to the ear. The nose is closer to the midline than the ear is. Posterior is towards the back. So the backbone is posterior to the sternum. Proximal is towards the point of attachment. So just like distal, it's in relation to limbs. Point of attachment for the upper limbs is the shoulder. Point of attachment for the lower limbs is the hip. The wrist is proximal to the fingers. The elbow is proximal to the wrist. The knee is proximal to the ankle. Okay, so the knee is closer to the point of attachment than the ankle is. Superficial is towards the surface. Skin is superficial to anything. So you can write skin is superficial to muscle. Superior is towards the top. So the nose is superior to the mouth. The nose is closer to the top of the body form than the mouth is. These are body regions. So all parts of the body are divided into certain regions, and we see relationships between this vocabulary when we start to study these body regions. When we start to study the bones, when we start to study the muscles, the veins, the arteries. Okay, parts of body regions always have very similar words to them. Cephalic region is the head. Digital is in relation to fingers and toes. Back of the upper leg is the femoral region. Back of the head is the occipital region. Shoulder is deltoid. Upper back is the scapular region, hence that's where we find the scapula. Bone. Vertebra is the backbone. Lower vertebral column is considered the lumbar region. Gluteal region. Back of the knee is popliteal. Back of the calf is sural. Front form, nasal, in relation to the nose area. Oral, in relation to the mouth. Cervical is neck. Thoracic is chest. Abdominal is stomach area. Umbilical is in between the abdominal cavity or the abdominal region. Pubic. Patellar is the knee. Orbital is in relation to the eyes, sockets. Side of the mouth or the cheek is the buccal region. Sternal region, upper chest. Armpit area is axillary. Upper arm is brachial. Front of the elbow, antecubital. Wrist area is considered the carpal region. And digital is in relation to fingers and toes. Inguinal is the groin area. Femoral, the same region as the back, upper leg. Side of the calf is the peroneal region. And the ankle is considered the tarsal region. These are different types of planes. So we can divide the body form into a left and a right, a front and a back, or a top and a bottom. So a median or a mid-sagittal plane divides the body form into a left and a right. A frontal or coronal plane will divide the body form into a front and a back. A transverse plane will divide the body form into a top and a bottom. These are cavities of the body. So this particular is bracketed to basically encompass the back of the body form. So this whole area is considered a dorsal body cavity. Within the dorsal body cavity, we have many parts of, obviously, the head and the spinal cord. And then we have the ventral body cavity, which encapsulates the thoracic cavities and abdominal cavities, so your heart, lungs, as well as your digestive organs. And then we have a lower cavity that's basically where you find your urinary and reproductive organs. Cranial cavity, cervical cavity, thoracic cavity. The thoracic cavity is divided from the abdominal cavity by a muscle. That muscle is the diaphragm. The abdominal cavity is below the diaphragm. The pelvic cavity is below the abdominal cavity. Now we're going to look at quadrants, and we are looking at a diagram. And what we always have to realize is that the diagrams are in anatomical position, and it's always the specimen's right side and left side. So a lot of people will make the mistake of identifying rights and lefts from your point of view, as opposed to the point of view of the specimen and or the diagram. So that is the right upper quadrant because it's the right side of that diagram in terms of the specimen. They're facing you. It's not your right side, it's their right side. So that's the right upper quadrant. Then we go right lower quadrant, left upper quadrant, and then obviously left lower quadrant. Within those quadrants, we have regions. Right hypochondriac region, right lumbar region, right iliac region. Iliac is your pelvis is made out of two bones. Each bone is considered an iliac bone. So it's kind of in relation to the pelvic area. Down the middle, we have an epigastric region, an umbilical region, and a hypogastric region. The left side is basically a mirror of the right side. So that would be the left hypochondriac region, left lumbar region, and left iliac region. These are going to be bones of the skeleton. So the upper bracket is in relation to all the bones of the head. So this is considered the cranium. Then we have a shoulder girdle and a thoracic cage. Now what we have to realize is that in this diagram, there are certain lines. So right here, this line is basically pointing to the same bone. Okay, so a lot of repetition in the lines, even though they are pointing to the same bone. It's just a front visual compared to a back visual. Same thing down here, down here. Okay, so we're not kind of filling in both lines. We're just filling in one. So starting from the very top, the line is pointing to the forehead. That's called the frontal bone. Your cheek is considered a zygomatic bone. The upper jaw is your maxilla. Lower jaw is the mandible. The next line is pointing to the collarbone or clavicle. And then the scapula, sternum. Next line is pointing to the ribs. The ribs don't articulate with the sternum. Okay, so you don't have articulation, means bone on bone. The ribs do not touch the sternum. They are connected to the sternum via what's called costal cartilage. And that allows your rib cage to be very flexible. So costal cartilage is the next line. The lumbar vertebra. This line is basically pointing to, and it splits, so it's encompassing all these bones right here. That's the pelvic girdle. Your wrists are made up of a number of bones. These bones are called carpals, metacarpals, and phalanges are fingers. Patella is the kneecap. And then we have tarsals. So you drive your car with your carpals, walk on the tar with your tarsals. Calcaneus is your heel. Phalanges for toes. So it's the same word for fingers and toes. They're exactly the same bones or bone structures. Metatarsals is your foot. The weight-bearing bone of the lower leg is the tibia. The smaller non-weight-bearing bone that supports some muscle attachments in the lower leg is the fibula. The large upper leg bone is the femur. The next line is pointing to the radius. Okay, the radius is always in line with the thumb. Okay, so the thumb is right here, and the radius is always in line with the thumb. So the radius is lateral to the ulna. The iliac bone. So you have two iliac bones that make up your pelvis. You have a piece of what we call fibrocartilage in between the two bones called the pubic symphysis. So that is kind of the joint of those two bones. Upper arm is the humerus. Occipital bone is the line pointing to the back of the head. The line pointing to the side of your head is the temporal bone. And above the temporal bone, kind of in the upper side of your head, is the parietal bone. And that is it. So that basically covers some terminology in terms of directional terms, body regions, quadrants, as well as regions within the quadrants, and then bones of the skeleton. So there are some practice quizzes posted on Classroom that you'll be able to master. Okay, so you want to run through those as much as you possibly can to prepare yourself for an assessment on this that will come later on in this 2-week period. But these are diagrams and words that you need to know and be able to label. Let me know if you have any questions. Have a good one.